So it's a really tough act to follow. But I have a challenge for you and your team, if you haven't already done this, because I know that you know, Dean, that it's almost impossible to control A1Cs if you have periodontitis, and it's something that I hope that you all will work on. And the second suggestion I have is I think we need you to go to Capitol Hill. I'm very serious to help get a lot of the junk food out of schools and things. Thank you very, very much. So, all too often, and in this case, oral health is not viewed as an integral part of overall health. Yet, oral diseases are often called a neglected epidemic. Today, among children 2 to 4 years of age, early childhood caries, or we refer to it as ECC, has increased 33% between 1988 and 1994. And 1999 and 2004. Further, from between 2006 and 2009, there has been a 16% increase in ER visits due to dental diseases. Most of this is due to diseases that we know how to prevent. Oral health literacy, you'll recognize this because it is the same as the one in the IOM report, and that we see frequently simply with the word oral health is included in there. And this is the one that is still used for the most part in oral health. Many people do not use appropriate preventive procedures, not by informed choice, but because they have never been taught about them, have no skills to seek information, or have no access to them. Further, increased oral health literacy provides people with the understanding and the means to exercise choice, and then, rather than suffering the consequences, which so many do. Oral diseases among children, especially in early childhood, is dental caries. It is a leading early childhood disease in the country, yet we know how to prevent it. Low levels of oral health literacy are associated with knowledge about oral health, frequency of dental visits, severity of dental caries or tooth decay, higher rates of failed appointments, and lower oral health related quality of life. These are dental results. So you can see they parallel many of those in medicine that we've known about for several years, but it's only been in recent years that we have actually had studies to demonstrate these correlations. So it's important to point out that we know how to prevent or control tooth decay, the most common childhood disease. And the way we know how to do this is through the appropriate use of fluorides, which we've known about for nearly 70 years, appropriate use of fluoride toothpaste, available for about 60 years, use of Pitt and Fisher sealants, which has been available for about 45 years, and periodic visits to the dentist. Yet, if you ask anybody, and I would wager a bet, if I had done a survey among all of us in this room, and I ask you, what is the best way to prevent tooth decay? You would have told me one of two things or both. Brush your teeth twice a day, never mention the word fluoride, and go see your dentist. Going to see your dentist is not really going to prevent a lot of diseases. They're mainly, and it's like in medicine, to diagnose and to treat. A lot of what we can do to prevent oral diseases are things that we do ourselves. It's behavioral invention. So in Maryland, there is what is called the Maryland Dental Action Coalition. And this was actually developed after Diamante Driver died, a 12-year-old who died from tooth decay. Now, many believed, and even still believe, that he died because he didn't have access to a dentist. Many dentists in our state and throughout the country don't want to see Medicaid children or adults. But the causes of the causes were really that he didn't have access to the preventive procedures that we've had around for many, many years. So the Maryland Dental Action Coalition developed a state plan. You'll notice that one of 3 focus areas is oral health literacy and education. So one of the things that we do in public health, of course, is always to do a statewide needs assessment. And we did that using surveys and focus groups. And we did telephone surveys with Maryland adults, random sample, who had children 6 years of age and younger, to ask them 2 major things: what they know about preventing tooth decay, and the second part was, what do you think the communication skills are of your dental providers? Because we were interested in these 2 things. We also did surveys of physicians, nurse practitioners, dentists, and dental hygienists. We asked them what they know and do about preventing tooth decay, and asked them what communication skills that are usually recommended are used, that they use on a routine basis. We also did surveys of Head Start coordinators and staff and WIC coordinators and staff. We did this so we would know exactly where we stood. We also did focus groups with each of these groups. It was mind-boggling what we found. So in addition to that, we conducted health literacy environmental scans. We conducted environmental scans on 26 out of the 32 public health dental clinics in the state of Maryland. All of this was voluntary. It's based on Rima Rudd's methodology as well as AHRQ's toolkit. And we included everybody who volunteered to do this. That was 26 out of 32. It included federally qualified health centers, city and county health departments. So what we found is that every year we spend thousands of dollars annually to treat early childhood caries among very young children who must be taken to the OR, given general anesthesia for treatment. We found that low-income adults with young children do not understand how to prevent tooth decay. They do not know what fluoride is, that it's in their water, and that if they drink it, it helps prevent tooth decay. Mind you, 98% of the central water supplies in my state are optimally fluoridated. But among Medicaid adults, they had no idea, and they were all drinking bottled water, despite the cost, despite the impact on the environment. So in essence, at least in Maryland, we have not done a very good job of educating the public and sharing the information that we know actually works. Low income tend not to drink the tap water for a variety of reasons. One of them is that they don't think it tastes quite right. They may think, oh, the color's different, maybe too much chlorine. But a major aspect was the fact that they didn't want to look like everybody else, because everybody is drinking bottled water. And as you know, I hope, bottled water, for the most part, does not have fluoride in it. There may be trace amounts, but none of those have fluoride in it. And yet it's drunk continuously by so many people. If you want to benefit from community water fluoridation, then you have to get it from the tap. And I urge you to do that. So we also found that healthcare providers do not use the recommended communication techniques. The majority had never even heard of teach-back, and certainly were not using it. This was across all provider groups. In addition, all of the healthcare providers, including the dentist and dental hygienist, really need to have reinforcement in terms of how to prevent tooth decay. Medicaid does not cover, this is another problem, Medicaid does not cover adult dental care in my state unless a woman is pregnant. If she is 21 and older, immediately after giving birth to this child, she's automatically off program. Yet, keep in mind that the bacteria that cause tooth decay are generally transferred from the mom to the infant. And yet, her mouth isn't important. So we're going to try and change that. Many dental care providers do not accept Medicaid-eligible children or pregnant women. So we have all of these challenges. So as part of the environmental scans, we found that there was only, because we found that there was such a lack of education on the part of the general public in terms of knowing what prevents tooth decay, that we did a major focus on the educational materials that they were providing in the federally qualified health centers and in the city and county health departments. And we found that there was one leaflet that wasn't used in all of these clinics, but there was one leaflet on community water fluoridation that I can promise CC that it would never pass, plain language. It simply, there was too much information in there. It was horrible. So we're going to redo that. Little or no attention was given to teaching mothers to clean their infant's mouth and to check for early childhood tooth decay or white spots that we call, which are pre-cavity. So to us, in this case, from a health literacy perspective, this is a perfect storm. There's no question. There is a ship down in there. I'm not sure you can see it. We're trying to save it with a few educational interventions. The IOM report, Advancing Oral Health in America, recommended community-wide public education on the causes of oral diseases and effectiveness of preventive interventions, and to include professional education and best practices on preventing oral diseases. In addition, professional education on best practices in communication skills is mandatory, and I think it's not limited to my state. So what we are doing now is the Maryland Dental Action Coalition, and this coalition came about after Diamante Driver died, and the governor at that time and the health director of the state said, never again will a child die in Maryland from tooth decay. And in collaboration with the Office of Oral Health, which is located in the Department of Health and Mental Hygiene, we have this Healthy Teeth, Healthy Kids. The purpose of it is to help moms help themselves and to help their infants to have good oral health, because we know how to do that. So what we do is work with pregnant women through prenatal classes, through WIC and Head Start and high school programs with pregnant teens. It's especially important to us to work in city and county health departments where it's under one umbrella, that WIC is also there, that OB-GYN and PEDS are there, because then we can get to all of these areas, not just dental, because dental cannot do this alone. WIC told us emphatically, we have absolutely no time to talk about dental health unless that is the issue of that client that day and that minute. So we have developed a few educational interventions. We didn't have the classy team sitting down at the end there, but we're going to try and figure that out too. So what we have done...
We got friends in Baltimore.
Yeah, good. I was thinking of shipping these guys, east. Moms need to know that they need to drink tap water and use fluoride toothpaste. They need to clean their infants' mouths as soon as they begin to bathe this baby. I want you to keep in mind that in prenatal classes, think back, and we teach moms how to clean every orifice of the body except the mouth. And if we do, then we start at the age of 6 months. Why? Because that's when the first baby tooth comes in. By age 6 months, let me tell you, that infant already has a personality, and the mom already has different habits. So we try to get them to start, as soon as you start bathing that baby, clean the baby's mouth. Then it becomes an established habit over time, and we also want to teach her to lift the lip once a month to look for white spots. That's lines And if you look at the other video, there's a plane in the atrium there, you can see what white spots actually are. But if they're white spots, non-cavitated, it is possible to heal those, to remineralize those teeth. This is very exciting, but moms don't know this. Probably most people in the audience don't know this, but it's very, very important because we can do this. We also need them to limit sweets and have a one-year dental exhibit, and they should ask their dentist or physician, because now 45 states in the U.S. Encourage physicians to use fluoride varnish on infants up to several times a year. Fluoride varnish works, there's good research on that, but most people don't know about this. So educational tools that we have developed is a video for pregnant women and moms with young children. And again, it is playing out there. I'm happy to share it with you on YouTube. Or I'll send you a DVD. We have developed posters and leaflets that support the video that are to be used in WIC programs, in PEDS, in OB-GYN, and we distribute these primarily in where low-income families will be. We've developed posters and leaflets and magnets, both in Spanish and in English. And this is one example, the English one, Lift the Lip. And you can see that it's really pretty easy, that can be done, especially if you begin early. And we want them to begin cleaning baby's gum as soon as you bring them home from the hospital or first bath. When baby is about 1 year, clean teeth with soft toothbrush and a smear of fluoride toothpaste. Lift baby's lip once a month, preferably on their birthday, to establish the habit to look for white spots. And again, to wipe baby's mouth twice a day. These, again, will be not only in dental offices, because that's not the only place that these can take place, but it isn't. Recall that the ultimate community effectiveness, or net effectiveness, of a preventive regimen depends not only on its ability to actually prevent whatever the disease is, but also the number of individuals who actually use that preventive regimen. If adults do not understand the value of community water fluoridation, they are not likely to get it from the tap. So we are starting a major campaign, and that is Fluoride Prevents Cavities. Get it from the tap. And I don't have that shiny red handout, and I don't have this wonderful crew, but we do have magnets, and if you're interested, you may have a magnet, both for Lift the Lip and for Fluoride Prevents Cavities. And I hope you'll watch the video outside. Our next steps are that we are going to be implementing all of these educational tools in the appropriate places with pregnant women. By the way, all of these educational tools are tested on moms. It's their ideas of what they wanted. If you look at the video, our moms told us that they wanted to hear from other moms. They didn't want to hear from us, the docs, the dentists. They wanted to hear from other moms, which that's basically what it is. We will then, once we have implemented this, we will reevaluate not only knowledge and understanding of all the groups regarding caries prevention, both providers and the public, but we will determine the percentage of infants at age 3, how many are caries free? How many can we decrease the number of children that are taken to the OR for general anesthesia and treatment? So that's it, and thank you very much.